Hello, my name is Bria, and today I will be presenting my project. The title of my project is The Silent Struggle, Exploring the Complexities of Depression. So, what is depression, you might ask? So, depression is a mental health disorder. It is a mood disorder, to be specific. So depression is characterized by feelings of sadness, feelings of despair, unworthiness, and things of that nature, and it can affect your everyday life significantly. About 3.7 adolescents experience depression, as well as 21 million adults. So it is very common in the U.S. Um, So some risk factors for depression can be low levels of serotonin in the body. Um, it can also be triggered by the loss of a parent or a sibling or any a major traumatic and stressful life experience, as well as low self-esteem, pregnancy, as well as other risk factors. So some signs and symptoms are feelings of sadness, a loss of interest, hopelessness, fatigue, suicidal thoughts, weight changes, irritability, insomnia, things of that nature. So you have to be, in order to be diagnosed with depression, you have to have 5 or more of the same symptoms within a 2-week period to be diagnosed. So those feelings of loss of interest, depressed mood, weight gain, insomnia, poor concentration, loss of focus, you have to have 5 within a 2-week period. Okay, so there are many different. There are a few different types of depression. The first is major depression. Then you have persistent depression, seasonal depression, postpartum depression, bipolar depression, and psychotic depression. Alrighty, so major depression is basically when individuals have at least one episode within a 2-week period. Also, it may be every month or every year, but there are episodes every month, every year or so. Persistent is chronic depression, and then seasonal depression generally happens when the seasons change. Typically, seasonal depression is triggered by the fall and winter months. Postpartum depression is typically after women can get it after childbirth, and that is a serious postpartum depression can be very serious. Bipolar depression, as well as psychotic depression, which involves delusions and hallucinations. Alrighty. So there are several different ways that you can treat depression. So first off, the pharmacological treatments include depressants. So medications such as SSRIs, MAOIs, as well as tricyclic antidepressants as well, can also help with depression. All right, and these particular medications increase the serotonin in the body. So it increases the serotonin, which is the happy hormone within the body, and it's responsible for a lot of other things, but one of those things is your happy hormone. Some other non-pharmacological treatments can be cognitive behavior therapy. It can be exercise. It could be nutrition. Nutrition plays a huge role in depression, as well as deep breathing exercises, guided imagery, muscle relaxation, and also acupuncture and reflexology. All of these help to lower the stress hormones within the body, which is really good. Someone that is suffering from depression may be recommended to go to social groups and supportive systems that can help them to get through whatever feelings that they're feeling, as well as just getting them out there so that they can be in a social environment. So that can definitely help depression. In conclusion, depression can definitely affect your life. If you are suffering with depression, make sure that you seek help, whether it's going to a friend or going to a doctor or someone that will be able to help you deal and cope with depression. If you are experiencing any thoughts of suicide, there is a number that you can call. You can literally dial 988 on your phone, and they'll be able to help you with any suicidal thoughts that you are thinking. Life does get better, things do get better, and my advice is to just stay encouraged and seek the help that you need. And that's it.